Hi everyone, we are doing a live after so long, and we chose this topic because I know a lot of you have been asking about it. So, yes, a lot of people have difficulty in conceiving due to so many reasons, and we have a special guest here today, and we are inviting her to talk about PCOS and mental health and difficulty in conceiving. Let's just have ma'am here so that we can start. Hello, hi. Please drop in your questions about difficulty in conceiving, any other issues that you might be facing, or you have queries down below in the comment section so that we can start today's video and we can start discussing. Hello, everybody. Hi, thank you for joining. Thank you. Please send your queries below. We'll be really happy to answer them for you. Ma'am is here, and let's just start with our questions. And so we will be basically discussing PCOS, issues with PCOS, and why this difficulty in conceiving. If you have any queries, send them here below. Hello, ma'am.
Hello. Hello.
Hello, ma'am. Thank you so much for coming and sharing your precious knowledge here with us. We're really thankful for you. And just a quick introduction as to who ma'am is and why she's the expert on this subject about infertility. Ma'am, please give a little bit introduction.
I'm Dr. Sandeep Talwar and I've been practicing infertility for last more than 30 years. I'm in Nova, Vasant Vihar,
And that
Delhi.
is what makes her the best judge to give answers to so many queries that you people have sent. So, ma'am, we'll just straight away go to the queries. So, first of all, there are so many people, even today, in spite of seeing so many videos, audios, so many YouTube videos, that are still confused as to what PCOS is.
PCOS is basically it's a hormonal disturbance between the male and female hormone in which the ovulation does not take place. So it's anovulatory. Patient does not make eggs.
And this probably results in difficulty in conceiving in the future.
Yes, because egg formation is mandatory for achieving a pregnancy.
And very commonly, ma'am, patients come to us and say that this powder will cure PCOS and this drink will do that. And we're tired of telling them that this is not particularly a disease and hence that it does not have a cure. So it is a syndrome, it is an issue, and it has to be managed. So some few quick tips to tell those people who are, I'm sure so many women are currently suffering from PCOS. They would really like your input on the same.
So first is lifestyle modification. So you should have a healthy lifestyle. You should be eating healthy. You should be exercising. If you are overweight, try and lose 5 to 10% of whatever weight you are. So have a healthy, active lifestyle is the first thing. If that does not help you to start making eggs or ovulating, then you go on to drugs which help you to make eggs. And if still that does not happen, you are still not able to conceive, then you come on to IVF.
Okay. Ma'am, what are the criteria? Like a lot of women, they have regular periods, but they still come in the PCOS category. So, what are the basic criteria that we can say that, see, you do not have PCOS and you have PCOS?
So even if you have regular cycles, you can still be PCOS. If your male hormone is high, the LH is high, or the male hormones are high, still you can have PCOS. You may have, normal cycles, but you still may have PCOS. So these are there are different subtypes of PCOS. So you may just have acne, or you may have excessive hair growth. Even that is one manifestation of PCOS.
Absolutely. So just not just missing your period is not enough for a person to have PCOS. Similarly, even having regular period does not completely save you from that. So there is a lot of criteria, like I mentioned. So there is ultrasound findings, there are hormonal imbalances and irregular periods. And your gynecologist is the best judge to tell you whether or not you have PCOS. So, ma'am, for people who do have it and they have been trying to conceive naturally and they are not able to do that. And as you clearly mentioned, that there is an imbalance between male and the female hormones that is happening in the body. So, what are the other ways that the couple, like, what is the first step after they have discovered and they have done lifestyle modifications and they're still not able to conceive? What is the first step that they should take after that to help them conceive?
So step one is you just go on to simple drugs, oral drugs like letrozole, or which is now the step. It is a primary drug for inducing egg formation in PCOS. If that does not help you, then the second step after lifestyle modification is either to see, you may need to use even insulin sensitizers like with these drugs like letrozole with the insulin sensitizers. Still, it does not help you. Then the third line is injectables. And then once you start injectables, then you should be coupling it either with an IUI or with an IVF to get better results.
So for people who have it, you need not think that ये तो अब end ही हो गया, अब मैं और कुछ कर ही नहीं सकती, अब direct IVF पे जाना पड़ेगा. So there's a lot of way to go. You can start with medicines, you can then go to IUI, then progress over to IVF, and obviously all of this under a doctor, which so find one good gynecologist, a good obstetrician, and just stick with them, follow through them. It is not that difficult, and completely with today's technology, today's science, it is not impossible. So there are so many ways that we can start, and it always goes step by step. Okay, ma'am, approximately what are the chances that a person with PCOS that they can conceive naturally, first of all?
They can conceive naturally. We talked about lifestyle modifications. So if you are overweight and you've lost 5 to 10%, your menstrual cycle will get regulated. You will start forming eggs. And the other step where you guys can help is de-stressing. Even that is a very, very important part of PCOS. So these patients get so anxious. They have irregular cycles. They're not making eggs. They are, maybe they have excessive hair growth. So there's so many issues with them. So if we take care of those issues, sometimes they spontaneously conceive.
Absolutely. So, like ma'am said, so first of all, I would also like to add here that a lot of people with PCOS have a lot of mental health issues also. Because again, there is a hormonal imbalance, there is so much stress to conceive, there is so much societal pressure, I would say, or personal pressure that women put on themselves, that why this is not happening. So, yes, meditation, yoga, therapy, physical activity, this will come first of all help you reduction of weight, which will help in regulation of the cycle and also will help you with your mental health, because a lot of hormones, a good feel hormones are really excreted in our body, like secreted so much during exercise, during sleep, and during any hobbies that you like to do, because of which a lot of mental health is also improved, like a lot of de-stressing happens. Plus, make sure you're talking to your loved ones, you have a family supportive system, your partner is supportive, you have people around you, you understand what you're going through. And yes, it is not just medical, it is also a lot of psychological things happening behind the scenes. So make sure you are following all of this, and I'll put the handle below. You can follow ma'am there because she puts a lot of very informative stuff about IVF, about infertility, and how women can help themselves with a lot of these lifestyle things. And yes, if something somewhere is not working right, make sure you are not waiting and you're consulting your gynecologist as soon as possible, so that a lot of issues can be tackled just right away.
Thank you.
Thank you so much, ma'am, for coming here. I'm sure the very informative session will, our audience will benefit from it. I'll link everything below. I'll try to write down whatever you have told our about the lifestyle modifications, and surely people can DM you if they have any further queries. Thank you so
Thank
much, ma'am.
you so much. Thank you.
Bye bye.